Hello and welcome to this month's update. The 23rd of March 2021 marked a year since the beginning of the first lockdown in England. To acknowledge this day, we lowered our flag at the hospital to half-mast and also published a special video montage, which is a collection of images and pictures over the last 12 months, which will resonate with many of you. If you've not had a chance to see the video, I would encourage you to do so, and you can view it on the Trust YouTube page. I'm sure there will be some images on there that will remind you of the tremendous efforts we have all made, as well as the generosity of our local people and some of the wonderful gestures we saw throughout the pandemic. Many of our clinical teams were redeployed to support the care of patients with COVID-19, which enabled us to double the number of critical care beds we were able to provide for those patients requiring ventilation or other advanced types of respiratory support. This was an amazing achievement and a credit to our teams across the hospital and community, who I know have worked tirelessly to continue to provide services in very challenging circumstances. Our response to the pandemic inevitably meant that a number of our other services were reduced and, in some instances, stopped altogether. And this has led, as is the case across the whole of the NHS, to an increase in patients waiting for planned elective care. I wanted to assure colleagues that we're currently working through plans to determine when the Trust will be in a position to restart our elective programme, and we'll keep you updated. Part of our considerations in developing these plans relates to the health and well-being of colleagues and the mental stresses and strains that COVID-19 have had on everybody. I would like to take this opportunity to remind everyone that there is support available to help individuals who may be feeling that this would be helpful. The Employee Assistance Programme is designed with this in mind and can also help with other stresses such as anxiety, bereavement, depression, workplace issues, trauma, relationships, finance and family difficulties. You can speak in confidence to a fully qualified counsellor and support specialist any time, the day or night, 365 days a year by calling 03330 380 0658. Despite the challenges of the pandemic, the Trust continued through everyone's great efforts to offer treatment to cancer patients. In fact, over the last 6 months, we have started to implement what is known as the best timed pathways for patients with suspected colorectal, lung and prostate cancer. These changes will help ensure that the time from the patient being referred with a suspected cancer to diagnosis and treatment is reduced, which often results in better outcomes for the individual. Our community services have contributed hugely in the effort to manage the pandemic and continue to ensure all those critical services to the wider population have been delivered. Many colleagues also supported the hospital-based response, in addition to keeping community services going, and I'm extremely grateful for their flexibility and assistance. We all know about the importance of vaccinations in regards to COVID-19, but there are a whole range of vaccinations which young children need to help protect them, and our communities from the spread of serious childhood illnesses. Our school nurses and health visitors, through creative thinking and fantastic planning, ensured that these critical vaccinations have been undertaken, which is a great benefit to our population and a real credit to them. As we move through the COVID-19 pandemic, some people are left with long-lasting effects of the virus. This condition has become known as long COVID, and it covers a wide range of physical and mental symptoms. We have a number of services to assist patients experiencing long COVID, including those provided through an outpatient clinic at the hospital and in the community, delivered by our integrated urgent care team, who are supporting patients in their homes to make good recovery. This is part of what being an ICFT allows us to do really effectively. As we begin to think about restoring our elective planned services, we have also been planning how we might reduce the number of people who would attend our emergency department with illnesses that we could treat effectively but by providing services differently. It would be really helpful if you could share the message with your family and friends that by calling NHS 111 before attending the emergency department, except in life-threatening circumstances, they will be able to discuss their concerns with the digital health team based at the hospital, who are aware of the potential help and support available across the locality. An example, the community paediatric team can assist in providing advice and care for children who are unwell but not necessarily need to attend the emergency department. In other instances, following a clinical assessment by the digital health team, and if appropriate, the team can provide prescriptions to be collected at the local pharmacy. I wanted to say a few words about our position in regards to nosocomial COVID-19 infections. Nosocomial is a term used when a patient acquired the infection whilst under the care of the hospital as an inpatient. Towards the end of last year, there was quite a lot of media interest in the issue, and the Tameside Glossop ICFT found itself in the spotlight for an outbreak we had seen in September 2020. I wanted to report back to you on this issue, and that over the last few months of 2020 and the first few months of this year, we have seen our numbers of nosocomial infections remain below the average for the North West. In an ideal world, we would see no cases of nosocomial infections. However, given the increase of transmission of the Kent variant of COVID, it makes it even more difficult to eliminate completely. We will continue to work hard on this important issue to ensure we remain as safe as possible for our patients and our staff. Back to the topic of vaccinations, we recently began our second dose of COVID-19 clinics, and I know that many colleagues will be pleased to achieve the full level of protection possible from the vaccine. It is another milestone for us, and it really does fill us with optimism about spring and summer and returning life back to normal. As a reminder, you will need to take your card you were given after the first vaccine with you to your appointment. Please also remember to check the date and time of your second vaccine, and if this needs to be changed, it must only be done if there is really no alternative. To change your vaccine appointment, you need to ask your line manager to put in a request to the email address displayed on the screen now. I hope you found this month's digital team brief interesting, and I look forward to updating you again soon.